Good morning and welcome to Carers Week 2021. This morning's workshop is all about health and promoting the health in carers and their loved ones. And we are joined by Amy from Hereford Medical Group, Lucy and her colleague, sorry, do you want to say your name?
Eva,
sorry. And Herefordshire Mind, Herefordshire Healthy Lifestyles team, Lee from the Defence Medical Welfare Service, and they'll each be given a run over of their services locally today. So I'll hand over to Lucy and Cams for the first presentation.
Thanks, Lauren. So just to introduce ourselves, so I'm Lucy Hornsby. I'm the lead mental health nurse at CAMS in Herefordshire.
and I'm Kiva Sheelan. I'm the assistant psychologist in the CAMS Learning Disabilities team in Herefordshire.
So we put together a brief presentation where we thought we would just discuss kind of what our service is and who we would work with, and then a bit of signposting as well. And then we've got the opportunity if anyone has any questions to ask them at the end. So I'll just share my screen again. There it is. Right, problem is that bar takes over there, doesn't it? You're going to go to these. Okay. So really looking firstly at what service we provide. So CAMS in Herefordshire is a tier 3 service. So the way that CAMS works is in tier system. So this is the approach that's worked all over the country. So tier 1 would be kind of general, like primary care, so GPs, schools, non-sort specialist care. Tier 2 is sort of slightly some more sort of intervention. So the tier 2 service that we often use to support mental health in Herefordshire is the CRD Trust. And then we fit in at tier 3. So we're a specialised service for those that have more complex and persistent difficulties. And then tier 4 is our inpatient unit. So there are currently no inpatient units in Hereford. So the nearest one is Birmingham. So it's quite far away. So I guess a lot of the work in our team is to kind of try and prevent admissions to hospital. So who are we? So we're a multidisciplinary team. So there's lots of us that work for CAMS. So we have mental health nurses, psychologists, OTs. Some roles are, I guess, so some roles are, although they're a different registration, they kind of do the same work. So we do have mental health nurses and OTs that do sort of therapeutic intervention. They're just trained in different things. So we have people that are trained in sort of CBT or ACT therapy. I haven't really spoke about the LD team, which I'm just very conscious about. And I can't remember. It's been a while since I've looked at these slides, so I can't remember what the next screen is. So let me just go on to that for a come back. Onto this one. Okay. So what's our criteria? So I think the confusion with CAMS is because unfortunately there is limited mental health service for under 18s in Herefordshire. I think people sometimes have the assumption that we would see everyone, which unfortunately we don't. So as I said at the start, we are a tier 3 service. So we would see people that have moderate to severe and enduring mental health difficulties. So CAMS in Hereford is set up predominantly into 4-ish teams. So we have general CAMS that would deal with sort of anxiety, depression, those kind of things. And then we have the learning disabilities team, which Kiva will tell you about in a minute. And then we have the eating disorders team, and we have sort of the neuro team. So, but we'll talk about a bit at the end. So do you want to talk a little about the LD team?
Yep, so we see children and young people from Herefordshire with learning disabilities. We don't have a restriction on our level of learning disabilities like some other counties. So we see people with mild, moderate, severe and profound learning disabilities. We're not commissioned to provide any support with physical health, only mental health. However, we as a team understand that the way that our young people express their mental health difficulties can be different than those without a learning disability. So we quite often see young people with lots of behavioural difficulties as well as mental health concerns.
So yeah, we do have the eating disorders team as well. They're quite a small team at the moment, but they are very busy. so they would just see people that having, I guess, they've got a diagnosis of anorexia or bulimia, so it would be quite significant eating disorders to meet their criteria. So as I said before, we do have a neuro pathway. So we assess for ADHD for young people that are over 7, and we assess for autism for young people that are 10 and above.
That's one of the reasons why it's really important that we have a multidisciplinary team, because as part of our assessment, we review young people from several different contexts. So we would need to see difficulties across settings, so not just in the home setting or just in the school setting. We would need to see difficulties across a wide range of contexts. We also need to rule out differential diagnoses, so we would need to consider the young person's whole experience from sort of prenatal, early life, and current context in order to understand whether there are difficulties and different ways to understand their difficulties.
And I say we're doing at the moment, so we do have an ADHD nurse specialist who works for our team, who holds the current ADHD caseload. In terms of autism, so our service is commissioned to provide assessment. Unfortunately, unless there's sort of comorbid mental health difficulties, we wouldn't necessarily continue work after an assessment process.
And we are commissioned, as Lucy said, to assess young people for ADHD over the age of 7 and for autism over the age of 10. For younger young people, they would be seen by community paediatricians.
Okay, so it's a bit confusing who we see. It did take me a long time to understand our criteria myself. So we've just done a little example of what the kind of things that we might see. So young person 1 would be, I guess, generally a typical young person that we might see in CAMS. So sort of quite a few significant episodes of self-harm, maybe some historic domestic abuse, quite enduring, so low mood for 6 months, sort of poor motivation, previously been seen by our Tier 2 service.
Young person 2 would be an example of somebody that we might see in the learning disabilities team. So we might see somebody who's non-verbal, variety of diagnoses, but they would have to have a diagnosis of learning disability to be able to access our team. As I said before, we often see mental health distress expressed through behaviour. So quite often we would see lots of self-injury or aggression toward others. We'd be looking for recent changes, and again, we'd be talking across different settings. So quite often we see young people who attend special schools, but that's not always the case. So we do also see people in mainstream schools, but who meet the learning disability threshold.
And then our young person number 3 is someone who they might see in the eating disorders team. So most of our eating disorders referrals are received from the GP, just because we would have a clearer understanding of kind of their physical health needs. So sort of excessive exercising, increased and rapid weight loss, specific eating disorder cognition. So, you know, that they're heavier than what they are, and then some physical health concerns as well. So what do we do? So we generally, in line with NICE guidelines, we would offer therapeutic intervention. So these are some of the things that we might do. So we offer CBT or ACT therapy. We have some play therapists, therapy, that work here. The eating disorders team offer family-based intervention, but we would do more systemic, so working with the systems around the young person. We do a lot of liaising with other professionals, so schools in particular, and we have a healthcare assistant that monitors physical health, particularly for those that are on medication or those that are open to our eating disorders team. So we don't, sometimes we might do an assessment and they might not necessarily be required to come to our service. So we kind of liaise a lot with other services and we signpost to a lot of other services. So like I've said a couple of times, so CRD is our Tier 2 service. They offer counselling support. So we quite often would refer to them. COOTH is an online counselling service. I think it goes up to 25-year-olds. So we quite often recommend COOTH. They have online services up until 10 p.m. So we've got school nurses. Then we've got specialists in bereavement services. the West Midlands Rape and Sexual Assault Centre. So our paediatric colleagues, that's both in the hospital and community peds. Again, we work closely with early help and with social care, I guess because lots of young people that we might see would have more complex difficulties and often be open to social care. What I didn't mention before is that we also have a specific pathway for children in care, which when children in care are referred to our service, concerns about their mental health, they would have a particular network meeting where social workers are invited and those kind of other professionals that are supporting the young person, so we can get more of a view of all the professionals involved. And that is it for us. We probably had a lot more to say, but I'm just cautious of the time. So does anyone have any questions that they want to ask?
With access to CLD, sorry, Lucy, obviously you can signpost in if it doesn't meet a tier 3 level down to that. Alternative routes obviously are going to be from GP, but can you self-refer into CLD or does it come for yourselves and just GP?
No, so you can self-refer, so any professionals can refer to CLD, and they have got a self-referral system as well. So they're quite flexible in, they would just take a phone call if people are happy to do that, if they're not confident with sort of computers and things like that. So yeah, they have a self-referral service. We have a pathway specifically with CLD. So if we get referrals and we deem them as maybe not tier 3, we would just pass them on to CLD for an intervention.
Great. And yeah, no, that's perfect. Thank you.
Thank you. That was really useful. And I think next up we've got Amy from Hereford Medical Group.
Hi everyone, so I am Amy Williams. I am the Senior Social Prescriber for Hereford Medical Group. I deliver a service to Hereford Medical Group. I'm part of a wider social prescribing team that is employed by the NHS, but we deliver our service out to all of the practices in Herefordshire. So wherever you're living in the county, you will have access to a social prescriber if you need one. I just want to touch on the support for carers at HMG initially. I've had a chat with our patient experience manager, and she's advised that when patients register with HMG, they can tell us that they are a carer, and they get coded as such, which means that we can collect data on their carer status. So for things like vaccination programs and things like that, we can easily capture carers so that they can be included in cohorts of vaccination programs and similar things like that. As well as being coded, they get registered as a carer. We have a carers register at the practice, as do all of the practices. And then our patient experience manager will actually send out either a message, a link to further support and information, or they'll send out a letter if we don't have a mobile number for a patient. And in there will be information about CarerLinks, about other carer support services, about the social prescribing service, about making sort of flexible appointments for the practice and things like that. So we like to sort of get in there early and get the information out to patients. If when you register, you're not a carer and become a carer later on, you can just call the practice and let us know. Whoever you speak to will pass the information on to the patient experience manager, who will then register the person as a carer, take some details from them, and again send out the information and links to support. They'll also be offered, obviously, signposting to CarerLinks. So that is what HMG specifically are doing to support carers. I can't speak for the rest of the practices, but I'm sure it's a similar basis. I know that carers are coded in every practice, and that there's a register for carers in every practice. But besides that, I should imagine it's quite similar. And then we've got social prescribing. So social prescribing is fairly new to general practice. I think in the county it's been here for about sort of 18 months, started with a pilot in one area of the county, and it's sort of increased now. So you can get a social prescriber anywhere. We are 10 a penny. And we work with adults, so patients who are over 18, who have barriers, I suppose, in the way of them being well. That can be anything. It can be that a person is a carer and is struggling to get help and support. It might be that somebody is living in inadequate housing. It might be that somebody has got debt issues and money worries. It might be that they are suffering from low-level, poor mental health. It could be that they have a learning disability, that they have dementia, whatever it is. If it's non-medical and it's stopping a person living their best life, then it's our job to help, really. So patients can access us through the practice only at the moment. We are expanding referral processes at the minute, but currently, if a patient wants to talk to a social prescriber, have a referral to a social prescriber, they need to speak to their practice. It doesn't necessarily need to be a clinician like a GP or a nurse. It can be that you can ring through to the telephony team and let them know that you're interested in a referral to social prescribing. And then what would happen is that I would usually give you a call. For some patients, they like to come in the practice, and I'm happy to facilitate that where I can. And we just like to spend some time getting to know each other, finding out about a person's circumstances and what's important to them and how things are for them at the moment and any challenges they might be facing. And it might be for some patients that perhaps a family member has just been diagnosed with dementia and they want some more information about, how the illness is going to progress, what kind of support's available to them and their family. And we can just sort of signpost on and provide contact details for dementia services and things like that. And it might just be one phone call. We have other patients that perhaps, are homeless or rough sleeping, who have money issues, who have addiction issues, and it can be a longer piece of work. We'll work with patients, to a greater or lesser degree for as long as they need us. We do like to take a strength-based approach. So we're very much, we're not doing this for patients. We like to do it with patients and support them to do it for themselves. Excuse me calling everybody patients. That's just how we refer to people, but obviously people. I think really, in essence, that's it. There is more information about social prescribing on the Hereford Medical Group website. There are a couple of YouTube videos that I can provide the links for following this meeting. Hopefully Lauren from CarerLinks might be able to include them somewhere for people, just where you can find out a bit more about the service. But we can link into other services. We work closely with the Healthy Lifestyles team that you'll hear from soon. I've worked with Lee Bailey from Defence Medical Welfare. We offer support for people who want to improve their lives, if they want to make positive changes. It doesn't necessarily have to be health related. It might be that they want to find work or training. It might be that they want to find a new hobby. It might be that they're feeling lonely and anxious about getting back out, and we can support them to find things that they might like to do, address any barriers or challenges that they might face in getting to do those things. And for some people, it might just be as easy as giving them the information. And in some cases, we might meet up. Perhaps if somebody wanted to go to an art class, we could meet them there so they could be introduced to staff and things like that, get to know people. So it's not so much of a frightening experience for people who are doing these things for the first time or for the first time in a long time. So so the scope of our job is really broad. We can't work with anybody who has got sort of what we would call moderate to significant mental health problems. We're not counsellors, we're not trained mental health professionals. If you've got mental health concerns, then you need to be speaking to the GP. We do have links with Herefordshire Mind and with lots of mental health resources. So if somebody's just feeling a bit low or a bit anxious or worried or concerned, or they would like to work on their mindfulness and sort of improving their mental health, then we can certainly help support them with that. You know, we'll refer to Healthy Lifestyles team if a patient specifically wants to be more active or lose weight or stop smoking, because they are the experts and they're fantastic. And so, yeah, so we've got lots of links with lots of local services. We also set up new services where there are gaps in support in the community. So I've just set up a training course for people who want to learn to deal with change. It's about sort of emotional resilience and things like that. It's an 8-week course, but you know, sometimes it's not necessarily about signposting to services. Sometimes it's recognizing that there isn't anything out there for people and working with providers to, you know, put something in place of that. So that's it really. If anybody would like more information, I would advise having a look on the HMG website or checking out the links to the YouTube videos, which I'll provide. And of course, send through any questions, which I'll be happy to answer. And that's everything. Thanks, Lauren.
Thanks, Amy. That was really helpful. And I think up next we've got Philippa and Zoe from Herefordshire Healthy Lifestyles.
Thank you, Lauren. I'm going to go first and then Zoe's going to follow. So I'm just going to share my screen. Let's hope this all works. Is that okay? Can you see everything? Okay. So we are the Healthy Lifestyle Service. We're part of the top community team in Herefordshire Council. And we're all about helping people to take small steps to feel good about themselves. We look at people's health behaviours and how we can support them to make changes to become healthier in their lifestyle. It's free and confidential support for anybody that lives in Herefordshire or is registered with a Herefordshire GP, anybody over the age of 16. You can be referred into the service by any other professional, or you can self-refer yourself via our phone, email, Facebook. You can just pick up the phone in and have a chat, and we can explain what support we have to offer. We have health trainers that are across the whole of the county. We have a number in different localities, so depending where you live, you should have access to a healthy lifestyle trainer. So the main areas that we sort of look at are losing weight or gaining weight if that is needed. We also will look at eating, sort of healthy eating, helping people to see where they're at with their lifestyles around their diet, if they want to make changes around what they're eating on a daily basis. And that could lead to losing weight or gaining weight if necessary, but it doesn't always have to focus on the weight. Some people just want to get some guidance about how they can get healthy eating into their diet more regularly. We also help people to become more active, and Zoe's going to cover this, so I'm not going to sort of dwell on that very much. She's going to explain how we can help support people with getting more active. And also helping people to reduce their alcohol intake. And we offer the stop smoking service. So the way we do these is that we would arrange an assessment appointment. That can be done over the phone, it can be done face-to-face, or it can be done video calls, depending on what people's needs are. And we try to be as flexible as we can with regards to appointments. So what we would do at that assessment is have a conversation around these areas, where they're at the minute with these areas and what they would like to do to make these changes. And we will help to look at their motivation, work out where they are with their motivation, what we can support them with, how they can support themselves to ultimately lose the weight, eat healthier, become more active, whatever it is they want to focus on. And we would do that over a period of normally around 12 weeks initially. It can change depending on people's needs. And that would be, they would be goal setting at that point. So they'd be setting a goal, maybe to lose weight or to be more active, and we would help them to break that down into more achievable goals. That's where the small steps come in. So we'd be looking at small, realistic goals each week, and then that hopefully will build up to that ultimate goal of losing weight, eating healthier, reducing alcohol. I've just put the little bit of information in there about reducing the alcohol intake. We won't support anybody that is dependent on alcohol. We would signpost that onto our drug and alcohol services within the county. We're really helping people manage that alcohol on a daily basis, to keep them within the guidelines. So you can see what the guidelines are there for adults. So for men and women, it's no more than 14 units in the week, 2 to 3 units a day, and trying to keep 2 to 3 days alcohol free. So if you're wondering what that is, a unit of alcohol is dependent on the volume of alcohol in the product and also the size. So you can see there, a large glass of wine, which is around 250 mils, is around 3 units. So your 1 glass of wine in the evening with your meal, that would count as one of your units. If you were to go over that, you would be increasing your units in the day. And you can see there, lager beer, 3 units, small spirits there, you can see 1 unit, and depending on the beer, 1.7 units. So trying to keep within those 2 to 3 units a day is what we would be recommending. And we would be looking at across the week what people's alcohol intake is, and then seeing how they feel they can manage to reduce that. And there's lots of different ways you can do that. And it's looking at some simple swaps, so for example, also the calories in alcohol are really high. So if people are wanting to lose weight, we would be sort of including the alcohol in that conversation. And it could be something as simple as going from your full fat, full sugar mixer to a low calorie soda, low calorie tonic water, low calorie soft drink, glass of wine. Instead of going for that large glass of wine, which is going to be 3 units, dropping that down to maybe 125 ml glass of wine, that's going to be around sort of 1 to 2 units. So again, you're reducing the units down. But you could also turn that into a nice white wine spritzer by adding some soda water to that. Again, you're reducing the sugar down by using the soda water, so that's going to help to reduce the calories. And if you have it in a nice tall glass, it's going to take you longer to drink it. So therefore, then you're helping, again, to reduce the calories and to reduce the units. So that's the types of things we would be looking at with making simple swaps, giving the advice and helping people set goals about how they can make the changes to their lifestyle. And that's what we would be looking at within alcohol, maybe suggesting a couple of days together in the week where they are completely alcohol free, and just giving them guidance around that. We would do similar with regards to diet, around making changes to what they're eating, reducing fat, reducing sugar, looking at carbohydrate intake. We would do that as well. So stop smoking support is slightly different. It comes through the same pathway, so you can access the service by email, telephone. You don't have to be referred into the service for stop smoking support. The health benefits of quitting, you can see there, it's never too late to quit. So we would have people referred into us or access the service themselves that have been long-term smoking. I mean, smoking for 50 odd years and maybe smoking 30 a day, really heavy smokers, and they think they can never do it, they can never stop, and they've maybe been advised their health has changed, their COPD, for example, has got worse. There's something they've been recommended to stop smoking. And those people actually come in thinking they'll never be able to do it, but actually with the support, they can do it. And we would really be saying, look, the health benefits of quitting are really instant. As soon as you put out that cigarette, you're starting to get health benefits. Your carbon monoxide levels that come from the chemicals from the cigarettes, they start to reduce very quickly. So that means then the oxygen can get into your system. You feel much more energetic, you feel refreshed, your breathing's much easier. Your sense of taste, sense of smell returns very quickly. So there's really lots of nearly instant health benefits that we can discuss with clients, and just say to them, look, it doesn't matter how long you've been smoking, how many you're smoking. If you stop smoking at any time, there are health benefits for that. So when we have a referral in for stop smoking, we will go through what their current smoking habit is, how many cigarettes they smoke a day, and what the triggers to the smoking is. So there could be emotional, they could be physical triggers. So we'll really have a conversation with people around what those triggers are to help them in preparation for their quit date. Now, we don't recommend cutting down because the nicotine within the cigarette is the addictive part, and even one tiny little puff in the cigarette will just keep that addiction there. So for other behaviors, we wouldn't advise complete cessation, but with stop smoking, we do recommend setting that quit date and being prepared for that quit date. And we would work through the client to offer them support, how to prepare themselves for that day, looking at who's around them that smokes, what those triggers are, getting them prepared for that, and setting that quit date and trying as hard as they can to stick to that. Now, that's easier said than done, of course. So we do bring in some stop smoking medications to help with that. And this is called nicotine replacement therapy. You can see in the slide here, there's a range of different products that we can use depending on what the client wants. The patch is one of our main products, but we can also bring in things like chewing gums, sprays, microtabs, lozenge, a whole range of different ones that we can use. And we would use those in combination, so the patches and or another product. And that really can help to keep the cravings at bay, help with the withdrawal symptoms. And we would use a step down approach. So depending on how many cigarettes somebody's smoking, we would maybe set them on the higher level, and then over the course of the 12 weeks start to step it down. You'll see there's a vape on the slide there. Now, at present, we can't offer vape as a medication, but if somebody is vaping, we will support them with that, or if they want to choose vaping as an option for stopping smoking, they can go to one of the local vape stores in town, and they can get some advice from there, and we would help them again around those triggers, around setting the quit date, using the vape, and possibly using a step down approach with how strong the vape is. So we do support vaping, and the guidelines are that it is 95% less harmful than smoking. So what we don't want people doing is swapping the smoking habit to complete vaping. We would want them to be using it as a means to stop smoking. There's more and more research coming out around vaping and the support with that. So the nicotine replacement therapy is accessed through our pharmacies. We have some pharmacies on board, and what we do is we send a voucher code through to the client, and they take that to the pharmacy, and then the pharmacy will dispense the NRT. So if the client doesn't have to pay for the prescriptions, if they have free prescriptions, then they don't have to pay anything at all. If they pay for their prescriptions, they pay a one-off prescription fee at the beginning of the course, and after that then it's completely free. So not only are we having health benefits and health incentives to stop smoking, there is financial benefits there, and for some people that is a lot of money, and we do recommend that you keep an eye on that, because it's amazing then at the end of the month how much money you've got. And that's something that could be used to treat the family for maybe a nice meal if cinemas are open again. So even a cinema trip, and we would sort of talk through, what are you doing with that money? Use that as a reward, because it's hard work. And we would do that with all our behaviors. We would be building rewards into that. How can you reward yourself for that change that you've made? You've met that goal. It was hard work. And making sure, of course, it's not rewarded with cake or a glass of wine at the end of the day, anything like that. So making sure it's healthy rewards that we're having as well. So that's really just a very quick sort of information around the service. Very welcome to contact us if you would like any more information at all around sort of what we do have to offer. We can also, very similar to the social prescribers, we have been to supermarkets in the past to help people with shopping. So if they're not sure what to buy, help them with budgeting around shopping. So we would go into the supermarket and help them work out what the healthier alternatives are. We can come up with meal plans with them. We can come up with some recipe ideas for them. And likewise, if they wanted to go to an activity, maybe it was a fitness class, or if they for their mental health possibly, or like what Amy was saying around loneliness, then if they wanted a new hobby or something like that, we would certainly help to signpost and put them in touch with other services as well, and possibly possibly go along to one of those activities with them, just to break down barriers as well, so that they can sort of, you know, it's quite nerve-wracking going into something for the first time. So having somebody to go along with you for that one-off visit to get used to that, to introduce them to whoever's running the group, then we would offer that as a small part of our service. It wouldn't be our main part, but certainly it's sort of the wider picture that we would look at as well. So that's really everything. Zoe's going to pick up following me on with regards to the physical activity, but any questions at all, just let me know. And our phone number's there and our email, but Lauren has all our information. So if you would like any further support or advice, please get in touch with Lauren and she can pass your details on to us. Okay, I'll stop sharing this screen now. Okay, thank you.
Hello. I'm Zoe. I also work with Philippa in the Healthy Lifestyle Service, now the Health and Wellbeing sort of community, and I'm specialising more in the physical activity side of things. So we do exactly the same kind of 12-week programme for people that want to get more active, as we do with people that want to lose weight or whatever it is. And it's all about talking to the client and figuring out what they want to change and how they want to get more active, because there's no point in us saying, well, you need to do this, this and this. It's about saying, well, what's going to be manageable for you in your lifestyle to make small changes to build in more activity. So we offer support one-to-one or in groups as behaviour change support with our particular service, but there's also loads of other tips and advice I can give you on getting a little bit more active in different ways. Obviously really, really good for both physical and mental well-being, and also just to take that time out for yourself, and it's kind of a healthy reward for your body and your mind for whatever stresses you've been through in the day or whatever achievements you have made. Biggest and I think the most important thing to talk about is walking, increasing steps, and we say your target should be around 10,000 steps a day, or aiming towards that. And if people are doing very little, it's just gradually building up to that. And that can be done by simple things like taking the stairs rather than the lift, parking a little bit further away from your destination so you have to walk the last little bit, getting off the bus and stop early, and then your general making the time to go for a walk. It's so good to be outdoors. You've got the biophilia effect, the feel-good effect of the great outdoors as well, and green space if you've got it near you, and you just get that, all the benefits you get from physical activity. It costs nothing, and you can just get out and get walking. In support of that, there is the Walking for Health scheme in Herefordshire, and the contact for that is Dennis Downey at Walk Herefordshire, and I will share my screen in a moment. Actually, I'll do that now, and then you've got all these contacts as I speak about them. Just a second. Okay, hope you can all see that. So yeah, I've got some details on there for you. For the Walking for Health, there's also on the Herefordshire Council website, there's loads of really nice walks and trails that you can find to choose your own walks and go it alone and go for it. But the Walking for Health is a really nice supportive way of getting out and walking in a group. It's completely free, led by volunteers, and just there to get people walking a little bit more. If you want a bit more, that's not just walking, there are currently some Nordic Walking classes available in Herefordshire. This is learning to walk using Nordic Walking poles. It's quite dynamic, it uses the upper body, it's great for weight loss, really good for core strength and stability as well. And those courses are starting throughout the year, and the information and contact for that is on there. That's Leonie at Ignite. And I'm actually a Nordic Walking instructor as well, so I'll be doing some of that. Also wanted to talk to you about a really good online resource that can be used at all levels really, but it's really good for those little snippets of time when you don't have much time. And it's called the 6 in 6 program, and the details are on screen. I'm not going to go through this too much, because if you go to the website, they demonstrate every exercise on there perfectly for you. But I'll just see if I can show you this. You get a bit of a pack with all the exercises and an exercise band. And the aim of that program is to build strength and stability. It's kind of pre-falls prevention, but really good for anybody who wants to start exercising safely at home, in their own time, in their own space. And on that website, they, like I said, there's a video of every exercise talking you through it. You can't go wrong, and it's there for anybody to use, completely free resource. So check that out. Other good resources are on the Talk Community directory. There's all sorts of classes on there from independent instructors, from your yoga, your Pilates, all sorts of things on there, and group sports and things as well. And also the NHS 1U site is a really good one for finding seated exercise that's completely free and easy to follow, and various other sort of more specific yogas for different things like that. Okay. I also run a exercise class in Stretton Suggers Village Hall on Monday mornings, which is a seated and standing class, adaptable for all abilities. So we have some people doing everything seated, nice and carefully, and some people doing jumping, leaping, star jumps and things like that, all in the same class. It's all adaptable. So what I thought I might do is get you moving a little bit. Please do join in, and I'll give you a bit of a taster of adaptable exercise that can be done seated or standing. So you can choose whether you sit or stand. I'm going to stop my share so you can see me, and I'm just going to put some music on. So before I start, I want you all sat nice and tall in your chair, all standing up. Hopefully you can see me. I'm going to come right back here. We'll put some music on and we'll get moving. So the music will catch up with me. So if you're standing nice and tall, shoulders back, chest up. And if you're seated, sitting at the edge of your chair. Okay, and I'm going to get you marching. Point the arms, lift the knees. And then circling the wrists. Keep those legs moving too. Take them up and down. Up we go again. And down. We're going to take a little side step, so step touch with the legs. Lovely. Keep going. You can bring the arms in as well if you want to. Then we're going to take a toe tap forward. So you're going to tap one toe forward, then the other. Then we're going to tap back behind you, under the seat. Then we're going to tap to the side. And heel digs. Keep those heels into the floor. Hug the arms. Then we're going to take it to a box step. So out, out, in, in. Then a little salsa. Little dance in the chair or standing if you want to. Lovely, back to that march. Pump the arms, lift the knees. And side stepping. Toe tap forward. To the back, under the chair. To the side. Heel digs. And let's do that box step. Out, out, in, in. Lovely. And a little salsa. Lovely. A little shake yourself off. Just want to show you what I mean by adaptable exercise, and then I'll let you calm down and not do any more. I hope you're joining in. Okay, so when I say some people can do things seated, some standing, I mean, basically, if you want to do a looping star jump, you can. Well, there's the half jack, which is a much more gentle option. You've got the chair to hold on to if you need to for support. Or you can do exactly the same exercise seated. And we do a lot of this in my class, lots of exercises that are timed for 1 minute, so everyone can do everything at their own pace and their own time at their own level. Thank you very much. I'm just going to turn the music off. I hope you enjoyed that. Didn't get too sweaty. I know I did. And I think that's it. I'll just share my screen again for you one more time so you've got all that information. And then I will hand back. And there you go, just for a moment, in case you want to jot anything down. Thank you very much.
That was wonderful. Thank you, Zoe. Thank you for your demonstration.
Boiling.
I did join in, but not with the camera on. So welcome to you, and thank you for sharing that. I think that's really useful for carers and everyone that's spending a lot of time in front of the computer at the moment. So thank you very much for that. And I think next on the schedule, we've got Lee from the Defence Medical Welfare Service. So I'll hand over to you, Lee.
Thanks, Lauren. Yeah, so those of you who haven't met me before, I work for a charity called Defence Medical Welfare Services. The charity has been going from strength to strength since 1943. The HQ is in Andover, but I'm just going to take you through, obviously, locally in Herefordshire, what we deliver from DMWS. So there's 2 welfare officers that work across Herefordshire. That's myself, and my remit is family welfare officer. And I've got a colleague called Ashley Winter who works with veterans as a welfare officer as well. Our service across Herefordshire is completely confidential and free service for families and carers of ex-servicemen and women, and that covers all the tri-services, including the RAF, Army and the Navy. We work with loads of multi-agency sectors, whether they're statutory within the local authority, third sector, as in other charities. And we pride ourselves within navigating across the armed forces community. It can be a little bit of a nightmare, sort of a navigating to find exactly what a veteran needs in terms of support. So we have got, we map out services and deliver them services to people that need them. So I'm funded within the Armed Forces Covenant here in Herefordshire, and we provide information, advice and guidance. I work as a single point of contact for our veterans and families and carers across Herefordshire, and we offer emotional, practical support. One of the good things about my role is that we're all trained in the medical health first aid course to deliver sort of a hands-on first aid if any of our veterans need it, sort of at low level. And obviously we work with all the mental health services locally as well. And I don't know how many of you are aware of it, but the NHS have got mental health services that are bespoke to veterans and their families, and we work in partnership with them as well really closely. It's the mental health, transition, intervention and liaison teams. And you might have heard that being abbreviated to TILS. And it's an access point for our veterans to access mental health services. So our service then is tailored and it is bespoke to each individual or family's needs. So when we get a professional or a self-referral in for somebody that's needing some advice or some emotional support, whatever it is, we will sort of tailor that service and assess the situation. And it's little bit like the social prescribing team. We'll build up the relationship professionally, and we'll find out exactly how we can support individual needs to that person. It's very much centered around the family. And we can deliver sort of advice on relationships. We work really close with drug and alcohol services within Herefordshire and different wellbeing groups as well. And that's just really in support of their general well-being to avoid any crisis situations, getting readmitted to hospital, going to the GP, and sort of just really laying off these really universal services if we can help decrease sort of the impact to our NHS as well. So we also, if we get referrals in, I handhold people into other services and signpost them. And when I say handholding, I sometimes will attend different groups with people that are isolated. I'll refer them into early help services to see if they can get funding for children into different nursery placements. I've supported people in different housing. It's just financial needs. We've got really good relationships with SAFA locally, the Royal British Legion, and we will just really work in partnership with them to make sure that the clients and the service user needs have been met. Yeah, so it's just a really quick overview for our service. I work mostly out in the community, and I've been working face-to-face delivering my service and working in partnership with people who have not been able to meet face-to-face, whether it be just helping fill out documentation to get things back to different people. I have access also to the community hospitals and hold an honorary contract with the Wye Valley Trust. So during COVID, an example of how we might sort of support our veterans would be to visit them on ward because they're really isolated, their loved ones can't visit them, and making sure that their care plan is robust for when they leave the care of the hospital. We work quite closely with Lauren and her team, obviously, if it's carers, to make sure that they're getting everything that they need as well. So there's not sort of we go from low level to sort of a complex cases in terms of support. Lauren has got my service leaflet that I sent this morning, which hopefully she'll distribute to you all, which has got my contact details on it. Feel free to give me a telephone, or if you want to drop me an email to find out a little bit more about the services. Obviously, I work solely out of Herefordshire, but if you've got colleagues around it that work in a different area, we are quite dispersed across England and overseas in Cyprus as well, Northern Ireland. But yeah, just pick up the phone, get in touch. But I think it's just really important, if you are working with people in the community, it's just asking that question, you know, are you a veteran? If you've got a family member that you care for that's a veteran, and at that point you can think we can refer into Defence Medical Welfare Services, and I would love to sort of hear from you or the individual. We always welcome sort of a self-referrals and try to get them to initiate contact themselves, because they've got to want to engage with us. But I'm a veteran myself of 10 years. I've got 2 young children that have lived the lifestyle of the military, and their dad still serves. So I kind of understand from sort of the levels of the emotional barriers and different things that comes along with military life, and it's not easy. And sometimes it's just having that common ground with people to sort of get them engaged in services and break down sort of barriers to other accessing services. It works really well. But it is just a bit of a whistle-stop tour of what I do across Herefordshire in terms of supporting our veterans and their families. And do reach out for any more information. And thank you for listening.
Thank you, Lee. That's really helpful. And I will share Lee's contact details and everybody else's with the link to today's session. I'm aware we're ahead of time today. And sadly, our colleagues from Mind haven't been able to join us today. So I think we'll end the recording just here.